What is myeloma bone disease?
There is a balance in your body between bone-eating cells and bone-producing cells. Bone-eating cells, the osteoclasts, are overactivated when you have multiple myeloma.
The myeloma cells are interacting with the cells that are around them, and since they sit in the bone marrow, the bone cells are close by. So myeloma cells activate bone-eating cells, osteoclasts. We have osteoblasts and we have osteoclasts. And osteoblasts build bone, osteoclasts eat bone, and this happens at the same time in everyone. In myeloma, the bone-eating cells are overactivated, so it can cause bone destruction. That's the bone disease. Most of the time it happens in areas where there are small plasma cell tumors. They grow, and then they cause some bone destruction causing a hole in this area of the bone. Some patients have more diffuse infiltration, and we're not completely sure, but some patients develop more a diffuse osteoporosis, meaning a weakening of the whole bone structure. That's also a different kind of way the myeloma can cause bone disease. So osteolytic lesions, focal changes in one area can be caused by myeloma, and some patients also have an osteoporosis also caused by the myeloma.
So the bone loss can be seen either by a DEXA scan, or it can be seen in X-rays. For instance, in a plain X-ray of the bones, we call that skeletal survey, or it can be seen in a CT scan or also in a PET-CT.
How severe is myeloma bone disease?
90% of myeloma patients over the course of their disease develop bone disease. The severity is very, very different. I have patients who have literally one lesion and that's it, and they oftentimes even develop nothing more. And then I have patients who come to me, they have a really severe bone disease. I have patients who lost several inches of height because of fractures. So it can be very, very severe. And even when we do a bone marrow biopsy, we feel that the bone is much weaker than if we do it in an MGUS patient, for example.